Good morning, gentlemen. I'm very thankful to US to allow me to present a case in such a wonderful CM in front of such a wonderful crowd. So my case, 55 years old female patient. I get this X-ray in the emergency room. Being super confident, મને એમ લાગે હું ગમે તે ફિક્સ કરી દઈશ. I go into the operation theater without a CT scan. My first mistake in this case, which I feel. On table, this is what I could achieve. I could see there was a huge void in the Calcar region of the humerus. I always have a habit of making such a video in all my proximal humerus fixations to see that the head and shaft are moving together, also to show to the patient and a personal satisfaction might be kind of. So I could see a huge void in the Calcar part of the humerus, but I still felt કંઈક જાદુ થઈ જશે, એ પીસ જાતે કદાચ ચોંટી જશે, ત્યાં ગઠ્ઠો બની જશે, the screws are locking. I felt these screws won't allow a collapse. So my second mistake to interpret that at this point. So at 6 months now this starts happening. I can see now that I had made a mistake on day 1. Still I feel that some magic would happen. કંઈક કેલસ બનશે, ટેરીપેરેટાઇટ હાથે ચાલુ કર્યા. Didn't help. At 10 months this happens. At 14 months this happens. Now the varus has started, the plate has started to back out, screws have started giving up. Patient comes at 18 months. In between, I explained once or twice for bone grafting. Patient was also skeptical. I was also expecting some magic. At 18 months now, the plate is about to tear apart the rotator cuff. So now I'm afraid I want to remove the plate. I get a CT scan MRI done. ક્યાંકથી એક મેજિકલ લાઈન એમાં રેડિયોલોજિસ્ટે મારા માટે લખી દીધી, healed fracture of neck of humerus. So with this, I go into the OR again, remove the implants. So deep inside the heart, I know something is still going wrong. This is the immediate post-op X-ray. Again, my habit of making that video, MRB again after removal, the head and shaft were moving together. I was happy somewhat, but I knew something big is coming. This happens at 2 months post-removal. Patient ne mattu natu, hath uchu thawanu બંધ થઈ ગયું. Patient goes to some other orthopedic surgeons, comes to me with this X-ray. સાહેબ 2 મહિના પછી હાથ ઊંચો નતો થતો, બીજા સર્જન પાસે ગયા, હવે એ તો કહે છે ફરી ઓપરેશન કરવું પડશે. So again I make some stories કે યાર જોડાઈ તો ગયું તું, મેં તમને વિડીયો બી બતાવ્યો તો પાછી કંઈક જર્ક લાગ્યું હશે, પાછું કંઈક તમે લોડ લીધું હશે એટલે આ ખુલી ગયું, this or that. But deep inside the heart I know that this was a day 1 failure. So now this time I go inside, I take a huge tricortical graft, fix it at the Calcar site, use a new plate, good screws, Calcar screws. This time now it really starts uniting. This is what happens at 1 month, at 2 months. Patient directly comes at 6 months. Fracture fully united with full range of movement, no complaints this time. So this happened almost 3 years after the index surgery, which I could have prevented. I learned from that case. Another case, again, a andar walo hero marto nathi. I go into the OR without CT scan. This time again, I find a huge defect at the Calcar region. This time I'm brave enough to call the relatives inside. I take a bone graft on table, put it at the fracture site. You can see the immediate post-op X-ray shows that tricortical graft. Again, my habit of making that video, everything is moving together. This happens as 3 months. Throm image, solid union, full range of movement. So the take-off message that Calcar of humerus, that is the medial hinge, it plays a very important role to prevent the varus collapse. Primary tricortical bone grafting should be used if comminution is there at the Calcar site. આ પેશન્ટમાં જો આ ગ્રાફ્ટ મેં એ જ દિવસે મૂકી દીધું હોત તો જે વસ્તુ એને 2.5-3 વર્ષે મળી એ બીજા પેશન્ટમાં જે 3 જ મહિને મળી ગઈ, I could have achieved. So that is the take off message. You have to be brave and always try to feel with the finger the Calcar region. If you are not even dissecting or stripping off the medial tissue, but have a habit to feel that is there any void at the hinge part or the Calcar part, and if there is a void, be brave to put primary tricortical bone graft right at that time. Thank you.